So thank you for that introduction, Susan. So as a result of receiving the studentship, I've had the privilege of spending the last 2 summers working with Dr. Rucka in his lab at the Brain Tumor Research Center at SickKids. And so we've been focusing our efforts on a project that is looking at using focused ultrasound as a way to break the blood-brain barrier, as a way to treat childhood brainstem tumors. So the learning objectives for this talk will be to evaluate the progress we've made so far in this project, and also where we're aiming to go with this project, as well as discussing the impact that this research studentship and this research experience has made. So diffuse intrinsic pontine glioma, or DIPG, is a devastating tumor that occurs almost predominantly in children, and it results in a near 100% fatality rate within 2 years. The tumor is located deep within the brainstem, and it grows diffusely, and so surgical removal of the tumor is not an option in these cases. Even further contributing to the devastating nature of the tumor is the fact that many studies have failed to identify even a single chemotherapy that can improve prognosis or survival in this tumor. And so with surgery and chemotherapy off the table, radiation therapy is our only treatment option here. And even then, the therapy only treats symptoms and has minimal impact on survival. However, in recent years, we've gained a greater understanding of the molecular landscape of DIPG, and this has allowed us to come up with new targeted therapies against the tumor, as well as to develop preclinical mouse models that we'd be able to evaluate these therapies in. But drug delivery, delivering drugs directly to the brainstem tumor, is a major issue here because of the blood-brain barrier. So the blood-brain barrier refers to the ability of blood vessels in the brain to keep toxic substances out of the brain. And what that means is that most of the chemotherapies that we can try using in DIPG won't even be able to get into the brain to reach the tumor. So one way that we can get around this issue is through the use of MRI-guided focused ultrasound. This is a technique that involves intravenously injecting microbubbles into the bloodstream while targeting a focused ultrasound beam at the area of the brain that we're interested in. And an interaction between these microbubbles, the ultrasound beam, and the blood vessel wall breaks the blood-brain barrier in a way that is both temporary and in a way that doesn't damage the tissues in the brain. And so using focused ultrasound, it's already been tried in real patients with more superficial cerebral tumors. This has been done at Sunnybrook Health Sciences Center. However, it hasn't been yet attempted in the area of the brainstem, which is a bit more delicate and houses more vital cardiorespiratory centers. And so there was a question of whether it would be a safe procedure to do there. And so evaluating focused ultrasound in the region of the brainstem was a big interest of our lab and is a focus of this project. And so what we've done is our lab has been able to demonstrate the safety of focused ultrasound within the brainstem using rats as an animal model. And so as you can see here, focused ultrasound doesn't impact heart rate or respiratory rate, both during or after the treatment. We've also been able to show that it doesn't have an effect on motor function or coordination, and it also doesn't result in any microscopic damage, such as bleeding or programmed cell death. And so now that we've evaluated that focused ultrasound is a safe technique we can use to open the blood-brain barrier to deliver chemotherapy to the brainstem, we just need a chemotherapy that we're pretty confident will be able to work against DIPG. And so what we've done is we've evaluated 8 conventional chemotherapies against 3 patient-derived DIPG cell lines in vitro. And what we found is that doxorubicin resulted in the most DIPG cell death at relatively low concentrations. And so we chose doxorubicin as a chemotherapy to evaluate with focused ultrasound because of its high efficacy in vitro, and also because it usually isn't able to permeate the blood-brain barrier. So we were very interested to see if it would be able to with focused ultrasound. And so we evaluated that, and what we found was when you treat healthy mice with focused ultrasound and inject doxorubicin, you get about 50 times the amount of doxorubicin getting into the brainstem than you would get without focused ultrasound. And even more excitingly, we found that the concentration of doxorubicin in the brainstem after the treatment is much greater than the concentration we needed to kill DIPG cells in vitro. And so it is showing potential as a treatment to combine focused ultrasound with doxorubicin. So to summarize so far, we have the technique, focused ultrasound to open the blood-brain barrier, and the chemotherapy, we can use doxorubicin to kill the DIPG cells once it gets in. And then now all we need is an animal model to evaluate this treatment in. And that's where we currently stand today. So currently we're working on 2 mouse models to evaluate this treatment combination in. And these mouse models are mice with brainstem tumors that represent as best as we can the unique context of DIPG in terms of the molecular and cellular environment. And so the first model we're working on is a patient-derived xenograft model. Essentially, it involves implanting DIPG cells from patient-derived cell lines directly into the mouse brainstem, and that allows us to evaluate this treatment in terms of the unique cellular context of DIPG. So these cells have also incorporated a luciferase reporter that will essentially allow us to monitor tumor growth using bioluminescent imaging while the mouse is still alive. Here we can see the bioluminescent imaging of a mouse that has successfully grown a brainstem tumor composed of patient-derived DIPG cells. The second mouse model we're working on is a bit more nuanced, and it's called the genetically engineered mouse model. It utilizes viruses to induce the 3 most common mutations that we see in DIPG in healthy mice. And so with these 3 mutations induced, the mice will spontaneously grow tumors within the brainstem that are able to model the molecular uniqueness of the DIPG. And so once these models have been successfully developed, we'll be able to evaluate how effective focused ultrasound is with doxorubicin within a unique context of DIPG, specifically with regards to its effect on tumor burden or tumor size, and its effect on the survival of the mice. And so if we're able to show improvement in survival and tumor burden, this would open the door to potentially a clinical trial in human patients with DIPG, testing a combination of focused ultrasound with chemotherapy there. And if we're able to, within those clinical trials, see a significant improvement, there would be little difficulty translating these results to the clinical context, since focused ultrasound is already an established technique that's been in use both clinically and in research settings. And so a quick note about the impact of the studentship. So this studentship has had many positive impacts on both of myself and on this project. I've been able to develop skills in lab techniques such as DNA and RNA extractions, mouse line genotyping, and so on. And it's allowed me to contribute to this project in a way that accelerates its progress, in particular on the mouse model development, which can be a very time-consuming process. I've been able to gain an appreciation of the scientific process, in particular how much time and patience is necessary that goes into these experiments, but also how much thoughtfulness and how much care goes into designing these experiments in the first place. I've also found it very exciting and invigorating to be part of a bench-to-bedside project in which the results of the study can directly be applied to the clinical environment. And I've been able to realize the benefit of being a doctor who can infuse their experience of clinical life into their research and science, and also as someone who can bring their research and science into their clinical life as well. I've grown a fondness for the brain tumor research area, and I'm very excited and interested in combining the 2 spheres of clinical medicine and research science in this area. And so it's with sincerest gratitude that I thank the Brain Tumor Foundation of Canada for giving me this opportunity to open my eyes to the field of brain tumor research. And I'm also very thankful to Dr. Rutka and the entire Rutka Lab for their support, their guidance, and mentorship. And would like to specifically thank Saira Ali, who I worked very closely with on this project. It's one thing to do rewarding work that you're very passionate about and that is very meaningful to you, and it's another thing to be able to work with a group of inspiring and motivating people that you look forward to working with every day. And above all, I'm indebted to the Turek family. It's through their generosity that made this whole experience possible, and for that, I can't say thank you enough. And that concludes.